Hello, I am Dr. Sally, licensed naturopathic physician in the state of Hawaii, and I'm here to help you improve your health naturally.
My name is Grace, and I'm a social media manager and producer of this podcast, and I'm here to be the question person. I'm going to be asking Dr. Sally some questions so we can get some insight into this wonderful, knowledgeable brain of hers. So first, Sally, I would love to hear a brief description of who you are and what you do, and we'll just start there.
Well, I'm a jungle doctor. I have a primary care practice. I have practiced in the jungle of rural Hawaii for 20 years, and I have seen a lot of crazy stuff. Where I practiced for a long time, it was pretty much just me. So if somebody had a problem, they brought it to me. So I got to see a lot of things to the edge of my scope of practice. And so that's what we call a steep learning curve. And so I have a lot of unusual stories and interesting insights for you. And have learned a lot about how to stay healthy with sometimes very little money and very few resources. And I do primary care, which means whatever walks in the door is what I do. Which means sometimes I have to do a lot of research because there might be a very rare thing you see in a textbook somewhere and I have to go dig it up and figure out how to help that person because they really have no other options here. So it's made me very flexible and creative.
Why do you do what you do?
Well, it's never boring. It's never boring. No, people are endlessly different and odd and complex. The level of complexity keeps me interested, and being able to crack a case or fix something that no one else has been able to fix is exciting and rewarding. So that's the reason I do the type of medicine that I do. You have to have a certain level of dogged dedication to improving humanity to be a doctor in general. But to be the kind of doctor that I am, you also have to be super curious and really persistent and a little quirky. Just a little quirky, to just stick with it because, there's no organization or institution paying me, which is a little scary, but there's also no one telling me what to do or think, which is a little scary, but also very liberating. So the opinions I have come up with through experience and trial and error and occasional failure. So that gives you a very keen feedback system for the truth. For finding out, sleuthing out the truth. And there's a lot of bull crap on both sides of the truth. So finding that middle ground is part of my job. I call myself a hot-eyed moderate. And what that means, that's a good tagline, right? Hot-eyed moderate means I care passionately about people and people being well and people being their best self. But I'm not cray-cray on either side. And I don't have a position to defend. So I'm not here to tell you all vaccines are bad. I'm not here to tell you all vaccines are good and you must have every one of them. I'm here to tell you this is what the data says and this is what the truth is as best as I can figure it out at the time. And the truth is a changing spectrum in this day and age. So you are looking at shades of the truth that you're allowed to see. And that changes pretty frequently. So that's what a hot-eyed moderate is.
I love this perspective of really being somebody who is investigating the truth and also not taking such a firm stand on either side, because science is all just a question. We're always just asking questions so that we can learn about our existence, our health, and our universe better and better and better and better.
Sure.
So you mentioned that a lot of what you do is primary care, where people come in and you have to do a lot of research sometimes, but the feeling of being the first person to discover what's really going on with somebody feels really exciting to you. Would you say this happens a lot in your practice?
Daily, yeah. Because people don't. Okay, so I'm a capitalist, so there's no... Right. No, I'm like the last true capitalist in this country, one of the few, because I'm not subsidized by anyone. There's no insurance paying your bill to come see me. You have to whip out the credit card to come see a naturopath in the state of Hawaii. Okay. We are really doctors. We are licensed by the state. We go through the same amount of training as a regular doctor and all that. We have board exams and blah, blah, blah. We pay licensing fees. All that crap is the same. But What's different is that we're like the underdog culturally. So you have to even be twice as good to be considered half as good when you're the underdog in a system. And the medical system is, well, we'll just leave that for now. And so you have to work harder to be seen, to be respected. But also, by the time people come to me, they have done the easy stuff. They've done the stuff that's subsidized. They've gone to their insurance-based doctor, several of them. Sometimes they have a stack of paperwork and charts. I've had people bring in boxes of paperwork from other doctors. Those doctors are in a system that only, no matter how smart they are, no matter how much they care, no matter how dedicated they are, that system defines the rules of the game for them and what they're allowed to look at, what lab tests they're allowed to order, what things they're allowed to prescribe, what nutrition they're allowed to even mention is all dictated by a financial goal, a higher power, if you will, of a financial goal that's laid upon them. And there's so many layers to that, and the suicide rate amongst MDs is skyrocketing because they're trapped in this system, and they know it. And it's the golden handcuffs for them. So I don't have the golden handcuffs, but if people don't get well, they stop coming, and then I stop getting paid. So I have this other motivation. It's very important to me to state for my own survival, not just my compassionate self, which is there, but for my own survival and the survival of my family, it's very important to me that my patients get better. So in the ancient Chinese medical system, a family would hire a doctor, and that would be their family doctor, and they pay that doctor every month, okay, until someone gets sick. Then the doctor stops getting paid, okay? Isn't that cool? So you want to bet that doctor's at the door, here, family, how can I help you? I'll be well, because they want to get paid, right? I think that's a beautiful system, and I would love to do something like that. But it's hard to translate that reality to this reality. Most of my patients, the ones that have jobs, which I treat at a massive level of income disparity. And I have billionaires in my practice, and I have people on food stamps in my practice. So I have to be very flexible about how we spend people's money. Yeah. So most people, they only come in after they've paid $900 a month for their Kaiser insurance or their this or their that. It comes out of their paycheck. They don't have a choice. So they're already medically impoverished and overextended before they even walk in the door. So they're still paying that every month. And now they're going to pay me $150 or whatever it is for a visit, and then they have to go and buy whatever supplement I'm recommending, so it's a financially difficult system in which to thrive. And in order to do that, you have to be effective, and you have to be effective quickly. Right. So that's what we do. Yeah. And the miracle is that it works. The miracle is that people get better.
I learned so much from hearing you talk, just in the way that you explain things. It's brilliant. We are going to be doing this podcast every odd Wednesday. You can expect to see a new podcast launched. Sometimes I will be here asking questions and having conversations with Sally. Sometimes there will be other special guests. Sometimes we'll even be talking to our friends in Kenya with the Many Trees Medical Cultural Exchange Program. And I'm curious if you want to touch on that a little bit and just mention what they're doing over there in Kenya and how it relates and connects to what you're doing over here in Hawaii.
So Many Trees is short for Many Trees Make a Forest. And that is a concept that is really important to me because cultural diversity is critical for the survival of our planet and our species, I think. And just already being in Hawaii and being a racial minority in this area in which I live and work has been a huge learning for me. And also part of naturopathic medicine is to look at the natural healing techniques of many cultures. It's a multicultural experience. So we're drawing on the traditions of many indigenous people to blend together something that's safe and effective, and then integrating that with our modern medical system. And so the complexity of that is breathtaking. But the good side of that is that there are many, many, many ways to get well. And there's many resources that we can use. So I have a huge toolkit. It's not subsidized, and insurance is not paying for it, most of it, but I can look in there and go, wow, you need this herb from Kenya, you need this mineral that's really found mostly in the Brazilian clay of the rainforest, et cetera, et cetera. So we put together a package for people that balances them and works. It's magic. So part of that is to use Many Trees is a program where we have friends in Kenya who are going out and interviewing people from different cultures in that community, in that area. And they're going to the elders in those communities and talking to them about what did they do to keep people well? What did they do before there were vaccines and before there were missionaries and before there were rural health centers funded by Gates? How did their people stay well? And that's something that we tend to forget as a culture. We have an impression of other cultures and other races as being inferior somehow to us, and we're just desperately waiting for us to show up with our drugs and save them. But we forget that these were vibrant, healthy, happily reproducing and thriving people, numbering in the millions, for thousands of years before we showed up. And so just honoring that and going, how can we preserve some of these traditions? And because we need them, frankly, we have great things and they do great things, but they don't do everything. So we're just trying to archive that and honor it and preserve it and bring what's useful of it transcontinentally. How can we preserve some of that wisdom, bring it here, use it here? And then the idea is to find let's just say there's an amazing herb. Oh, this is so cool. Yeah. Okay, so I got to tell you guys about the coolest herb on the planet, I think. This is like a chicken skin herb. Do you know what chicken skin means in Hawaiian?
No,
okay,
I don't.
So you know what goosebumps are?
Oh,
okay.
yeah.
So the pigeon version of goosebumps is called chicken skin. Okay, so in Hawaii we say chicken skin. Oh, they gave me chicken skin, auntie. Yeah. Okay, this is a chicken skin herb. This is so cool. This herb is called strophanthus in English. Africans have their own name for it, which I don't know because I'm culturally ignorant. But in America, it's called G. strophanthus or blooming liana. And this herb is a vine that grows in the deepest, darkest jungles of Africa, right? Like there's that whole cultural, but it grows it's a jungle plant. And it is a vine that has traditionally been used in hunting. And so the people of that area would take a resin of this vine and concentrate it. And they would put it on the tips of their arrows. And then they would shoot animals out of trees. And the animal would fall out of the tree, hit the ground, asleep. Not dead, but asleep. Okay. And this is observed by anthropologists who are studying these people. And then the people would then kill it and eat it. Okay. So, but it didn't harm them to kill it and eat it. So it means it's not particularly super poisonous, right? Because you can shoot an animal with it and then you can eat that animal. Okay. Yeah. So the story is, and I don't know if this is true, but the story is the first anthropologist to observe this behavior went and licked one of the arrows. Now, that's kind of dumb. I do not recommend that you go out and study some jungle tribe and lick their arrows. Please don't do that. That's not what I'm saying. Stop.
Sketchy.
However, that is what Indiana Jones of Africa did. Okay. And he got really calm and mellow and his heart rate slowed down. Okay. And that was the first medical indication that this herb has an effect on the heart. It turns out that this herb is a healing herb for the heart. Wow. And it reverses certain forms of heart disease, like reverses them, like flat out. Like I can stop a heart attack. And I have done this in the office with this herb in minutes. Okay. Whoa. Literally, I will tell you, I have a tincture of this herb in my office waiting. And I had just learned about it. I had just done the study on it. This is credited to a man named Dr. Thomas Cowan. Mm-hmm. He teaches doctors how to use this herb. And so I just taken his little training and I'd gotten the herb and I'm all waiting. And so that my door bursts open and this person comes in carrying this man who was passed out at the bus stop across the street from my clinic. And he goes, hurry, you got to help him. I'm like, what's wrong? He's having a heart attack. And so it turns out this other guy knows this guy who's in a wheelchair and he knows he has heart failure and heart disease and he's had multiple heart attacks. Wow. And the man had a heart attack at the bus stop. Yeah. And there's no bus. And the ambulance, let's just say, by the way, the Hilo Medical Center is an hour away. Yeah. Okay. So he's gone, right? Mm-hmm. So I'm like, okay, is my malpractice insurance paid up? Okay. Right. So I lay this guy on my table and I give him a double dose of this herb, like a strong dose of this herb. And within minutes, his eyes are doing this. And then within about a minute, he's sitting up. Within about 5 minutes, he's like moving. He gets up off the table. What? And he starts doing this little jig. He's like, I'm all right, doc, I'm all right. I'm like, okay, that's great, but sit down, right? And this is a man, I mean, he's in a wheelchair because he's weak, not because he's paralyzed, right? Yeah. So he was actually able to stand up after having a pass-out probable heart attack at the bus stop. That's what this herb does. Right? That's what now, so here's the sad part of that story. And this goes to the idea of working in a low-income community. So there's tragedy and there's beauty and everything. So I give him the bottle. It's my only bottle of this herb. So I give him the whole tincture bottle. He's not my patient. He hasn't paid me a dime. I don't even really know this man. But I'm like, okay, here, take this and go to Hilo Medical Center and get checked out and do your due diligence, right? So they take him out, and he has the bottle, and he uses it faithfully every day. And I kind of forget about him. And a couple months later, I asked his friend, hey, how's your friend doing? And he's like, oh, he died. I'm like, oh, that's really sad. I said, what happened? He said, he ran out of your herb. And 3 days after he ran out of your herb, he had a heart attack and died. And I was like, right? Like, oh my God. Like, that was so freaking sad. Wow. And it's like, that could have been prevented if our culture had a way for me to be paid enough to keep my doors open and be able to see this man, right? I could have gotten him. This herb costs $15 a month, $20 a month. Like, that's what it costs, right? But I was not in a situation or a system to be able to get it to him or follow up with him or anything. So he died. Now, I want to pop in here and let you know that this patient had left the hospital against medical advice, not recommended, and that we also called 911 immediately when he was brought in. And we were standing by ready to perform CPR if we needed to, which we didn't because this herb is amazing. So the amazing thing is this herb exists, and we could get this to people, and it comes from deepest, darkest Africa, right, as a tincture, but it's not patentable. No one's going to make any serious amount of money on this thing, right? So there's no profit motivation, so Big Pharma's not interested. You cannot patent an herb and sell it for a profit.
Right.
So the minute you do your research or you get it FDA approved, which is millions and millions of dollars, any Tom, Dick, and Harry can go and grow that herb and sell it and undercut you, and there's no profit. So that is why it's not. What Big Pharma has to do is take a chemical out of a plant, which they do all the time, change that chemical to make a unique molecule, patent that, and sell it as a drug. Right. And that's what they do. Right. But they haven't done it out of this herb yet that I know of. So anyway, so that is an amazing, sad story. Yeah. But just to show you how potent some of these things are, and the fact that we need to be researching them, honoring them, documenting them, growing them, and making them available. So our idea is to go out and find these things, and then hopefully one day buy farms in the area that are sustainably managed and hire local people in that area to run these farms, grow these herbs, sell them at a profit with fair trade to Americans who desperately need them, and make them available. So it's a full circle concept. Yeah. But it starts with education, and it starts with preserving the cultural heritage. So that's what we're doing. That's what Mini Trees is.
And I'd say that's a big reason why we're doing this podcast as well, just to bring education and awareness to you guys, wherever you are watching this, regardless of what your situation may be or your history may be. We want to be able to provide information that is not only accessible, but could, help you or a friend or a family member, somebody you know, right? Like when we learn about these herbs, maybe even if it's not a farm that's growing it, maybe it's like, well, that could really help me. I'm going to start cultivating that herb. And it can all start from these kinds of stories. So that is really powerful. Thank you for sharing. So something that you say a lot, and something that I think speaks really loudly about your practice and what you do, and just naturopathic medicine in general, is real medicine, really different. I would love to hear a little bit about your perspective on that.
Where do I start, and how many people do I want to piss off? Well, people think, first of all, most people don't know what a naturopathic physician is. Yeah. So they come into this, and this ignorance is especially relevant and pervades the medical community. And people tend to fear what they don't know about or don't understand. So there's a lot of perceived competition and fear between different aspects of medicine, between alternative medicine, natural medicine, and conventional or allopathic medicine. There's a lot of disdain on both sides, to be honest, but mainly from the majority towards the minority. And there's a lot of ignorance or discrediting of the skills of each side. So the fact that I went to 5 years of medical school and 4 years of undergraduate and 2 years of special preparation to get extra science credits because I got a liberal arts degree. Don't get a liberal arts degree. The fact that I did that, I've had 25 years of school total. I mean, if you count grade school and all that, that I did 2 years of medical residency in a primary care clinic, that I'm board certified and licensed and take continuing ed every year. The fact that I do all of the things that the big guys do, I've had more medical school credits than a Yale medical school graduate of the same year, like more. So some of that is because I'm just overly enthusiastic, but that's, what it is. So when we say real medicine, what we're saying is we've walked the talk and we've earned the right to be doctors and call ourselves physicians in this culture, in this cultural paradigm in which we are. And that's not to discredit herbalists or homeopaths or people that do all of those other things. It's not to say that those are not real, but they're not medicine. The medicine is the ability to take a case, assess all of the variables of that case, and make a valid diagnosis of what the heck's going on with this person. What is wrong with this person? If you know what's wrong with this person, then you have all of the first steps in place to figure out what will help them. Okay? So the difference between a doctor and a care provider is that a doctor is trained to make a valid medical diagnosis. And so that's what real medicine is. Okay? You can say, oh, chamomile is great for a nervous tummy. But if you don't know why that person's stomach hurts, you don't know whether what you're suggesting is really safe and effective. If their tummy hurts because they have stomach cancer, you're not going to get very far with chamomile tea, right? So that's where the pedal hits the metal, okay? So, and that skill is something that MDs and DOs and NDs all have, okay? Really different means that we have different core philosophies about what medicine means and how we do that, okay? So the first precept of naturopathic medicine is do no harm. First, do no harm. Now, that's in the Hippocratic Oath too, to some degree, but we really mean it. Like, for me I can prescribe pretty much any medication, but before I prescribe a medication, I am looking first to see what else is safer and more effective. Remember, I have the great big toolbox. So I don't just have drugs and surgery. I have a million things I could pick from. So I'm looking to see what is going to do the most good for the least harm every time. Mm-hmm. So I might write 2 prescriptions a day. A regular MD might write 30 prescriptions a day for a drug, right? So we have the same toolkit but in that way, but we use it very differently. Because they also share that, at least theoretically, in concept. Although let me point out that allopathic medications used as prescribed kill hundreds of thousands of people in America every year. Hundreds of thousands. Yeah. Okay, so are they doing no harm? I don't know. Okay. But the, right? Yeah. Well, what does do no harm mean? Real. But the main difference is, to me, is treat the cause. Okay? Treating the cause is, in concept, is the difference between a naturopathic doctor and a regular medical doctor. Medical doctors are trained to use drugs primarily to manage, control, and suppress symptoms, to make people feel better, which sounds great. And sometimes we need to make people feel better, but conceptually, what a naturopath is striving to do is to find out why. Why are you sick? What is causing this thing at the most core, deepest causal level that we can perceive? Okay, which takes way more time and way more energy, sometimes more money, sometimes more testing. It takes more time, usually, to figure out cause. But when you figure that out, then you have a great big clue as to how to permanently, I mean, we all die, so not permanently, but semi-permanently, fix it. So treating the cause it's so much more important to me than just suppressing a symptom. But only certain people are interested in that. There are vast swaths of the population who just want the quickest way to make symptom X go away, and they don't care about anything else. So they're not our patients. They're not people that would want to see a naturopath. Someone who wants to see a naturopath wants to go, what is going on here? Like, you have to have that kind of ruthless curiosity to really embrace what we do.
You're really looking at the whole person. You're really looking for the root cause, and then you have this wide toolbox that you can choose from to, treat whatever that root cause might be, to really permanently, or at least, long term
Let's just say long term.
have an impact on this person's life. So I think this is pretty self-explanatory, but I would love to hear why, from your perspective. Why naturopathic medicine over conventional medicine? Imagine you're talking to somebody who is the person that just wants to treat the symptom and doesn't care about anything else. Why naturopathic medicine over or in tandem with the conventional system?
Most people take better care of their car than they do of their body.
It's true.
Okay? Most people would acknowledge that if you don't change the oil in your car, eventually that car gonna die. Okay? And you're gonna burn out a very expensive engine. So when we externalize it and we go prevention is boring. Prevention's really boring. I mean, it's not sexy. It's not exciting to take your car in for an oil change. It's not sexy to rotate your tires. It's sexy to race down the street really fast, right? So we as a species are kind of geared towards doing the exciting thing. We get a lot of adrenaline. We get a lot of juice out of doing the short-term exciting thing. But the people that survive, the people who have things that last, are the ones that take a step back and go, what do I need to feed this entire system and make it healthy? So it's more of a systems approach to a longer term fix than your short term pill is going to give you. And also, normally, so I get two kinds of people. I get the kind of people that are just naturally curious and intelligent and motivated in that way. And then I get the people for whom the other system has failed them, a big fat F. Okay. They have tried all the pills. They have taken all the things. They've done all the stuff. They have had the surgery. They've had this, and it hasn't worked. So they are frustrated. Yeah. So they are pissed off, frustrated, irritated, weary, resigned. Like I hear at least once a week, you're my last hope. Like if you can't fix this, no pressure. If you can't fix this, then I'm just going to go home and die. Right? I hear that frequently. It's very stressful. And so it's sort of like an alcoholic has to hit rock bottom to like show up at AA and go, okay, fine, now I'll do the freaking work, right? Like, what does it take to get you to your rock bottom where you have to change the way you view your body and take care of your body and treat your body? Are you going to run this all the way out to the end and drag it out? Or are you at some point, are you going to go, well, maybe I need to look at what's making me feel so bad, and there's usually, there's also a third group. There's a group for whom they have such a complex problem, or what we call a multifactorial problem, that they're smart, they are curious, they are investigative, but they can't figure it out. And those are people that are not naturally into natural things. Like we have people that are just sort of inclined towards granola and Birkenstocks and armpit hair, and they're just very natural as an orientation. And they're people that would prefer to see a naturopathic doctor. It's just part of their personal aesthetic or their personal concept of self. Okay. And that's a whole group of people. And then there are very conventional, very traditional, very normal people with regular jobs, mortgages and all that stuff. And they are just frustrated as heck. They have been through the ringer. They've gone to every doctor. They've taken every pill, and their problem just keeps getting worse. And they have a realization that they have to do something radically different, and they cannot figure this out on their own. And the usual reason for that is that they have multiple problems feeding into a symptom. So most people are really good at looking at their world and assessing, hey, when I drive over, nails in the road, I get a flat tire. Cause equals effect, right? And then I go and have to have the tire changed. But when it's 4 or 5 or 6 different things, okay, when you have a gluten allergy and a hormonal imbalance and a hugely stressful home, and let's just say arsenic poisoning from a volcano, when you have like all of that going on and you feel like dog snot and you can't figure it out, and you're drained and tired from trying to figure that out, then you need outside help to tease all that apart and go, let's test this, let's do this, let's try this, let's change your diet this way, and to work with you until you've tracked down all those leads. And then you just re-put the person's life back together and go, okay, here you go, do it this way. And they feel better, right? But it's not easy and it's not quick.
I love how you explained all the different types of people that might come into your practice and what they might be facing, because I think health it's something that we all share and we all desire, but the way that we go about seeking out that support is different depending on our belief systems or the paradigm that we've been raised in. So I would love to talk a little bit about the stigma of naturopathic medicine, right? Like this maybe cultural, societal belief that it is less than the conventional path. And not everybody believes this. And I think it's something that's growing in acceptance for a lot of people. But I would love to hear your perspective on that stigma.
Well, people tend to bring their preconceived ideologies into any experience they have. And health is very vulnerable. It's a vulnerable place for people to be. So their fear level and their distrust level is high. And there are a lot of quacks out there of all types, right? So people have had the experience of being taken for a ride or wasting their money on a supplement on the internet. Or going to someone who charged them a ton of money and did nothing for them functionally. And that can be people of any, I mean, astrologers can take you for a ride. Like any profession can have that. But culturally, this goes all the way back to Rockefeller. This goes all the way back to the turn of the century. And it's a trade war. Basically, you are all victims of a medical trade war that's been going on since the Fleckner Report. The Fleckner Report, okay, so here's the history. So in the 1800s, there were many, many, many medical schools and training centers for care providers, doctors, okay? And many of them were homeopathic. Homeopathy was huge. And I'm not particularly a homeopath, but I know the history of it. And there were medical schools that used all kinds of traditions. And some of their stuff worked, and some of their stuff was, But there was a large body of thousands of years of cultural history of how to take care of people that was being taught in training centers and schools all over the country. And then methylene blue was the first drug that ever got invented. Methylene blue is a fascinating story because we use it today naturopathically, ironically. But methylene blue was a dye that was used to dye slides of tissues to look at cells under the newly invented microscope. And then it was noticed that methylene blue, the dye, was actually killing malaria inside red blood cells. And you could see this under a slide in real time. You could see that the slides treated with this blue stuff, the malaria inside the red blood cells was dying, but the red blood cell was living. It was so bizarre. So that was the first time that people thought, wow, we can make a chemical that can do something good for the human body. Like we can make something that can improve someone's health and save a life. So that was an earth-shattering revelation. It was the first drug ever invented, okay? And it came from looking at tissue samples. So now this is a drug. But then what happens is we get this idea that we can make these chemicals that can do things to the body that can heal the body. And that's great. But then we get greedy. And people go, wow, how can I profit from this? How can I make money from this? How can I own this concept? Okay. Right. And so more and more drugs get invented, and then they become, long story short, they get patented. Mm-hmm. And once you invent a chemical that does a thing and you patent it, it's yours, and then you get to sell it and make tons of money. And that is the core problem where all of this trade war stuff started happening. The AMA got invented. The AMA is a lobby organization and a trade organization that owns doctors, basically medical doctors. It tells them what they can say and do, how they can treat, and what they cannot do. And it will strip them of their licensure and their ability to make a living if they step too far out of line. That is why doctors are so frustrated and compliant as a group. Yeah. And that's why I'm not a medical doctor, because I did not think that my personality would be congruent with staying in such a system without, stirring up some stuff. So anyway, so that's the long story short. So what Rockefeller did is he manipulated the system to send someone out to study medical schools, to rate them for their quality, okay? And so this guy went out and he looked at all the medical schools around the country, and he was heavily coached, let's just say, into giving good reports to schools that used chemicals to treat disease and giving bad reports to schools that use natural substances and practices like hydrotherapy and homeopathy to treat disease. And he put together this report called the Flexner Report, and it was so derogatory to the naturally oriented schools that all of the naturopathically oriented medical schools closed, except one. So by 1954, there was one naturopathic medical school left in the country, and it graduated like 6 doctors. Right? It almost killed us completely. The only way that school stayed alive, it's National College of Naturopathic Medicine in Portland, Oregon. Hail to the mothership, right? And they managed to stay alive by joining a chiropractic college. Okay?
Wow.
Yeah, and that's how they stayed alive. So that was the nadir point of our existence, and it all had to do with that drugs were becoming insanely profitable, and in some cases are insanely effective. So they work quick. They work with the human mind. They're quick, they're fast, they're dramatic, they're abundant, and they're profitable.
Right.
So that's super luring to people. So as part of that indoctrination, drugs are good because they make us lots of money. Everything else is bad, right? So doctors themselves, who then only have these chemically oriented medical schools from which to choose, are going to go into those schools. And then I don't know if you know how mind control works. If you have a prisoner of war, let's say, and you want to interrogate them or change their mind or make them believe a certain thing, what do? You create sleep deprivation.
Yeah.
You basically partially starve them. So the way medical schools work, and naturopathic schools unfortunately are modeled after the big boys. So we have our own version of this. So we're not off scot-free with this. But medical schools are actually structured after military medical training, which is some nasty stuff. Okay, so it's survival-based stuff. You have to have people that are able to go to the front line in XYZ horrible country and stay awake for 36 hours and work on people. Like that's how that training, it's a rite of passage. It's a harrowing ritual. And it creates a form of mind control in doctors to where they believe without question what has been fed to them. They're not allowed to question. You're worked 60, 80, 120 hours a week for weeks at a time. They do rotations where they are forced to stay awake for 24 to 36 hours. There is absolutely no reason to do this to train someone for a career. It is about indoctrination and hypnosis and convincing you that this is the way to go and nothing else is acceptable.
Right.
Okay. So that indoctrination, by the time they get out of that, first of all, they go, I have the right to say that I know everything there is to know because I've been through such a horrible experience that was so grueling that I must have learned it all. Because if I didn't learn it all, so what they'll literally say to me is, if I didn't learn that in medical school, it's not worth knowing. I've heard that so many times. If I didn't learn it, it's not worth knowing. If it's not on my board exams, it's not worth knowing. Okay?
Yeah.
And that's what they honestly believe, because what they did was so extreme and so horrifying, frankly, that they've earned the right to feel that way and to say that. So I have lots of compassion for that.
Yeah, for sure.
Yeah.
Sounds kind of similar to like trauma bonding.
Absolutely, trauma bonding. It's an entire culture of trauma bonding.
Yeah.
And so there's that. And then there's the hypnosis aspect, plain and simple. And then there's the expectation that if I did all this difficult stuff, I know everything there is to know. So anyway, so some of the worst stigma experience I've had is just trying to deal with regular doctors. So I can present, here's a case, here's the data, here's the research, here's the labs, here's the results. I can present the most perfect ironclad case study to someone's MD, and they won't even read it.
Yeah.
They're afraid to look at it because I think they're afraid that I might know something they don't know. And that's not acceptable if you've been through that kind of trauma experience. To say, I went through all that and I still don't know about this case, right? So it's frequent. So people say, oh, will you talk to my MD? I'm like, sure, I'll talk to them, but I really doubt they're going to talk to me. I really doubt it. 1 in 1,000 may call me,
Right.
So the fact is they have 7 to 15 minutes per visit to be with someone. 7 to 15 minutes is the average amount of time an MD gets with a person. Okay? Just let that sink in for a minute. That's the national statistical average for a medical visit in the U.S. Okay? 7 to 15 minutes. That's what insurance pays for. The rest of your time, you're there for an hour or 2 hours, but where are you spending it? In the waiting room, in the little room alone with the gown on, with the medical assistant that took your blood pressure, with the receptionist that took your insurance card, with the checkout person, right? How much time do you spend with the doctor who's trying to figure out how to save your life? Right. So I spend an hour to an hour and a half one-on-one with the patient every time. That's my visit. Okay. So is it understandable that if we have the same amount of training, the same type of degree, the same background in pathology, et cetera, the same access to laboratory testing, okay, that I might know a little more about patient X than the MD that saw them for 10 minutes?
Yeah.
It's quite likely that I do.
Yeah.
Okay, right. So no wonder people get frustrated and threatened by that, because I'm coming in going, well, I've done all of this research on this case. You had 10 minutes to look at the person. What do you think, doc? It's threatening.
Yeah.
You know, so there's a little bit of jealousy. We're jealous of them because they make 10 times more money than we do. They're jealous of us because we get 10 times more with the patient than they do. Mm-hmm. Yeah. But, you know, a lot of people come into this the other way around too, and they make stupid decisions based on it. Okay. So, for example, I have a cancer patient that's newly diagnosed cancer patient, and he will not go to the MD that I'm recommending he go to because he doesn't want to know what the MDs think about his case. And I'm sitting there going, you know, they have lots of really big tools and really good imaging stuff, and they have access to equipment that I don't have access to. You need to know what their whiz-bang machinery is telling you about what size is your tumor, what type is it, how fast is it growing. There's basic things you need from that community when you have that disease that he does not have access to because of his bias against them.
Yeah.
So you can throw the baby out with the bathwater either direction,
Right.
and make a stupid decision.
Right. That comes back around to what you were saying at the very beginning, how you don't take a drastic stance on either side of the spectrum. I think that gives you a lot of space to pull from this toolbox without the bias and really, really help people beyond the tools that you might have readily available in your office.
There is a caveat to that. If I think someone's doing something that's just butt-ass stupid, I'm just going to tell them, I think what you're doing is stupid. I don't care who it came from or why you think that, but that's just stupid. Don't do that, right? Yeah. So there are times when you have to be extreme, you know, and make a clear line in the sand. Yeah, no, that's really dumb. God, I wish I could think of an example. I'll think of one, and it's going to blow you away because there are many.
I want to say too, like, I definitely come from the background of going to so many different doctors with so many different questions and experiencing things in my body that I knew was not normal for a young person to experience, and being told, oh yeah, you're having these gut issues, we'll just put you on stomach liners. And I would say to them, I'm not taking anything. Like, why can't you actually ask me questions? And I didn't realize the back end that they only have that short period of time to actually spend with me to get paid by insurance, right? That makes so much sense. And that's also why, you know, I have personally transitioned into more naturopathic medicine. I mean, it's something that I have always known and trusted in. But it wasn't until going through those experiences in my life of consistently being disappointed by the medical system that I just was like, you know what? It doesn't matter if my insurance doesn't take this. Like, I got to do this because at the end of the day, our health is the most important thing that we could have.
Like, you already have the orientation towards curiosity and questioning. And then you also have the complex multifactorial problem that's not solvable in 10 minutes. Yeah. Right. So, yeah. So basically, for an MD, if you have a problem that is easily treated or cured by a medication or a prescription, you're in great company, right? Or if you have something that can be easily cured by a procedure, that's a great place to go. If you break your arm, please don't come to me. Like, I learned how to set your arm in medical school. I've never set an arm since then. Okay, I'm not going to put your arm in a cast unless there is no one else available. You need to go to the hospital where they have an x-ray machine and they have someone who does this every day and they have the drugs to numb you if you need it. Like, there's times and places to seek different kinds of care. Yeah. So I have people for whom I am their only doctor. Like, I have Seventh-day Adventists or Amish people or just people with various religious strictures against medical care who don't see me as a real doctor either. So, but that's good. They're like, yay, I can see you. And I'm like, I don't don't know if that's a compliment. Like, really, I don't know. But, I do my best I can for them, But sometimes I'm just like, dude, you need to go to the hospital. And they won't go. Like, I've had people where they can, okay, so for example, this lovely Amish man, he's the sweetest man ever, with the hat and the suspend. I mean, wonderful, but straight, strict, down the line. Whatever his particular religious orientation is, he does not believe in regular doctors. And he comes in to see me, and he is having an impacted gallbladder attack. So that is an extremely painful condition where there's a gallstone stuck in the duct and will not come out, and all of the bile is backing up into his liver, and he's basically digesting his own organ internally. Okay. And this is going on and on and on. And I'm doing everything I can think of to convince him that, in this case, surgery is fine. Surgery could save your life, because if this thing ruptures and explodes in his gut, he's dead. Yeah. He will digest himself from the inside out, quite likely. Right. So we know this is a medical emergency, but he will not go, no matter what I say to him. So am I just going to kick him out on the street to die because I don't want to risk my malpractice of him dying in my office or dying under my care? It's a really challenging situation. Like, what do I do? So I have him sign a waiver saying, yes, I'm aware that I could die and I refuse all other medical care. Give me what you got. Okay. So then I go to work on him. And I did super strict diet. We did gentle abdominal massage. We did castor oil packs. We did homeopathy. We did herbs. And it passed. And he was fine. And he lived. Wow. But I could not guarantee that he was going to live. Like, that is not something I was trained to do. I was trained to triage this person, get them to the ER, and I stand behind that. If it were me, I would have gone to the ER. Okay? So people make different decisions based on their belief system and their personality. And part of this position is allowing people to be who they are and doing the best you can for them. But it's closing, like, I will tell someone, if I were in your position, this is what I would do. Yeah. What do you want to do? Yeah. So it's very dicey, but it's part of why it's exciting.
You're basically always kind of experimenting, and collecting data.
That's why we call it a practice, not a perfection. It's always a practice, never a perfection.
Right. I want to touch on a little bit what the process is of actually assessing a new patient when they come into your office and how that might be different. I know we talked about the difference between you get an hour and a half with them, whereas the conventional doctor maybe gets 7 to 15 minutes. But what is it about the way that you connect with your patients and the questions that you ask them that helps you navigate their situation to ultimately help them find the result?
The bottom line is actually being genuinely interested in what is this person's world? What do they eat? How do they live? What are their stressors? What's their environment like? That's the most important thing. If you don't have that, nothing else matters. It all becomes mechanical and routine. So from that, you just ask someone, what's going on for you? What's your life like? What are you needing? And people will tell you. If you give people space and attention, they'll tell you exactly what's wrong, and they'll tell you why it's happening most of the time. So people often have an inner knowing that's suppressed, okay? That if you just allow time and space for that to come out, they can uncover it for themselves. And that's the best knowing, because if someone has a self-knowing about it, then the treatment plan's easy, and they're going to do the treatment plan. Like, I come up with these very detailed treatment plans because I know it's going to take X, Y, Z times 10 things to fix this. But I can't guarantee someone's going to do my treatment plan. The best treatment plan in the world is a useless treatment plan if the patient ain't going to do it. They're just going to take it home, put it in a drawer, go about their life. But if you can help someone realize for themselves, this is what's blocking my health, and then they will do authentically what it is that needs to be done, or fix what's blocking them.
Yeah.
So, So, but we do interview. We do an intake. We have paperwork. Right. There's medical history. There's what drugs are you taking? And then we do a physical exam, and I do a head-to-toe physical exam, and that's a dying art, by the way. This is all these Zoom medicine and all these people. It's possible to see doctors endlessly now and never have anyone actually touch you. Like, it's insane. So, because if you're doing chemically based mechanistic medicine, that's perfectly acceptable. Here's a list of my symptoms. Here's the right drug to fit that. Here's the prescription. Beep, boop, boop. Go to the pharmacy, pick it up. Never saw or touched that patient. Have no idea what their gut feels like or their skin feels like. If they have a coating on their tongue, nothing. You get nothing. So that's not really medicine. That's something different. That's chemical-based symptom-specific prescribing, I would call it, but it's not medicine. Because medicine is looking at all of the pieces and coming up with a diagnosis based on all of the pieces assessed. Okay, so in our office, we do a head-to-toe physical exam. There's like 50 to 100 different things we're looking at during that exam. Some of them have nothing to do with what you came in for, you think,
Right.
but they really do, because it's holistic. I don't like that word holistic, but it's accurate. So we do that usually on the first or second visit. Sometimes people's story is so involved that it takes an hour or more to hear what their story is. And then we do the exam on the second visit. And then we usually order lab work. So there's all different kinds of lab work. There's holistic lab work. There's woo-woo lab work. There's conventional lab work. And people have different preferences for that. Some people love a little bit more out there assessments, a little bit more fringe, let's just say. And some people are very straight-laced and they just want the blood work, And so you kind of go by what that person likes and wants and needs. And then you have another visit where you come in and you put all those pieces together, where your lab work says this and your physical exam says this and your symptoms are this. So obviously what's going on is this, right? And then you have the joy of figuring out what to do with that person, or for, not with, for that person. And a lot of that has to do with what they are willing to do.
Right.
Okay, so that's a whole nother assessment. What is this person ready, willing, and able to do, and what can they afford? Because there's nothing more frustrating than saying, I know how to fix you, and you can't afford it. That happens a lot.
Yeah.
So, yeah, and that's something we don't talk a lot about, but I think we should talk about it more.
Thank you for sharing about that process. I think that might be helpful for people who are maybe considering transitioning into going to a naturopathic medicine. Maybe they're at this point where they're really frustrated with conventional medicine, but they're like, maybe feeling a little intimidated. Like, what is this process going to be like? Right? It's really simple. It's really like easy. And honestly, from my experience with it, like so much more comforting. Whoa, this person actually cares about why I'm here.
Ooh, okay. Well, first of all, you don't have to choose. It's not an either or thing. We do complementary medicine as well, which means I have plenty of patients who go see their PCP for their insurance when they're supposed to, do all that stuff, and also come to see me. And some of them hide it from their regular doctor because he or she is judgmental, and they'll sneak in to see me. I don't want Dr. Smith to see me seeing you, so I came on a Wednesday because I know he plays golf there. Like, I have people do that, right? And I have people that will go to their regular doctor, get prescribed a crap ton of drugs, pick them up from the pharmacy every month because they track you now, whether you picked up your prescriptions, and throw them away because they don't believe in them. They don't want to take them. But they don't want to piss off that doctor. And they've had doctors say, well, if you don't take your statin, I'm going to fire you as a patient. And they're scared because they don't want to have that safety net of, what if I need to go to the hospital? What if I get cancer? What if I get something and I need you to refer me? They don't want to lose that insurance safety net. And they're paying for it, so it's their right to have it, right? But they can't be honest. So, and I am not judgmental about that at all. I'm like, dude, whatever you need to do. Take the meds. I just want them to be honest with me. Are you taking them? Are you throwing them in the garbage? Are you taking them every now and then? I just need to know. And then I tell them what I think. I think statins are poison. And I think no one should be taking them, period. It's one of the drugs that is absolutely 99% of the time a poison. Yeah. So I will tell them, if you choose to take poison because they've convinced you that it is, here's my evidence to the contrary. Here's my websites. Here's my data. Here's my research. Here's 20 books you can read. Here's the evidence. You decide, and you tell me what you're doing so I can at least help you cope with that. Yeah. Okay. So as long as people are honest with me, I can work with it. But I'm on this side of the one being, okay, we'll do what you need to do. And there are some amazing, open-minded, integrative medical doctors out there. There really are. So there are some that I work with that you can tell them anything and they'll duly note it, and they fight the insurance company's mandates to them and still manage to keep a job. So there's some strong ones out there that know what's going on. Yeah. But they're rare, and we treasure them. They're precious, precious doctors, precious. But the thing you need to understand about insurance-based medicine is that you are not the client. You are not the one being served in an insurance-based medical system. You are the product. You are not the client. Okay? And that shift of perspective is chilling when you finally realize it. It's horrifying. You think you're the patient. You think you are the client. You think you are the one that is being served by this whole system. But to the medical clinic to which you go, you are the product. And the client is the insurance company.
Right.
Because the insurance company writes the paychecks
Right.
for everybody in that clinic.
Right.
Okay? And so you are productivity. So the number of hours of seeing patients they can log determines how big their paycheck is. It's a numbers game. It's not whether you get well or not. It's whether you get seen and get billed for being seen enough for them to make their overhead. And there's a very steep overhead that medical clinics have to make.
Yeah.
Okay? And if they don't see enough patients and they don't bill enough, they go under. It's as simple as that. So you are the little bean under the cup that's being shuffled around, and your health is only important to them because they're caring people, but not because of the system that they're in. So the individual doctors care about patients very much. I'm not saying they don't. I'm saying the system they're in does not reward that. The system only rewards financial productivity.
Yeah.
And so you have to work with that system if you have insurance. So the best thing you can do if you're going to see an MD in that system is to come in and say, okay, doc, I know you got, how much time do you have? Okay, you've got 20 minutes. Great. So my most important thing is I need lab tests because my liver hurts. So can you please write that order? Okay, now I also have a bunion. Should we schedule another appointment for that bunion? Because then they'll get billed, the insurance company, again, to see you the next time.
So if you go into the doctor's office, you want to make sure that you are taking basically one thing at a time. Because if you go in with all these different symptoms, they're going to get overwhelmed because they only have that window
Right.
to be with you.
Right. You have to work with the system that you're in. As the product, you have to know that to get the most out of that system. And that has nothing to do with the MD or the doctor or the PA or whoever it is that's caring for you. They may care for you individually as a person very much, but their system is pushed towards productivity and billing. Okay. So they will only get to bill for 15 minutes, 20 minutes, 30 minutes, whatever it is. The more you put into that visit, the less effect, the more overwhelmed they get, and the less they're able to actually help you. So they can't help you with 6 things in 15 minutes. There's no way. So the first thing I would do if I were going to see an MD is say, how much time do you have for me? And then you prioritize your most important things and present one thing at a time and let them work on that one thing and say, okay, next time I'd like to talk about this and this and this, right? Otherwise, you're just, they go, and then they get really brittle and fragile and burnt out, and it's a frustrating thing.
Yeah.
So that's reductionistic medicine. So we do holistic medicine, where in order to really figure out your case, I need to know that you get skin rashes easily, and your poop is clay colored and it floats, and you get floaters in your eyes. Like together, that makes a whole picture for me of a liver disorder. So we know we need to do liver detox and liver cleanse and labs to test your liver, right? So I put all those weird pieces together and come up with one or more underlying causes for all of those things. And that's a beautiful thing when you see that working. But the chance of you getting that kind of evaluation from a primary care and medical office in an insurance system is pretty low.
I think that that's something that's going to be really, really valuable and something that we're going to continue to address here on this podcast. I'm curious, just maybe very short, going over what future developments or changes you see happening with naturopathic medicine, and maybe some ways that you are already taking part in those changes or collaborating in the expansion of how things are changing in our world in the way we view medicine.
Naturopathic medical schools are becoming more popular and more accessible. That's great, but it's also not great, because we're having a trend which we call green allopathy happen in our profession. Green allopathy means we are basically becoming MDs who use herbs instead of drugs. So the core philosophy, the concept, the treat the root cause idea is being subsumed by the financial motivation of running with the big dogs and being able to bill and take insurance. So when naturopaths are able to accept insurance, the pressure is on them. And I worked in an insurance system. I used to work in Washington State as a primary care provider for a major insurance company. So during my residency, that's what I did. And I can tell you that even with all of this philosophical training, once you get into the field and you are billing per visit under that system, the pressure on you to subsume to that system and become reductionistic in your thinking is overwhelming. Yeah. So we are pushing as a profession towards acceptance and popularity, and we risk sacrificing our roots to that. So are there going to be people left that value and honor our traditional roots? I think so, because truth tends to shine through. Truth tends to win out. Core values tend to hold their integrity over time. So I think a lot of people are going to go through, just like there are some amazing MDs in the field today that have gone through the regular medical system, have worked in hospitals, have worked in clinics, have done all that, have churned their way through that, have seen the light, have rejected all that, and bravely struck off on their own. And they're on the internet now. They're all over the place. They have clinics all over the country. There's a whole integrative medicine movement. Okay, so they've come through that system, and a few brave ones are like the salmon swimming through the locks upstream. They've made it, right? Naturopaths are probably going to go through the same thing, where a lot of them are going to become insurance-based shills, but some of them are going to stick that out. And as a profession, we're pretty feisty, and we're pretty individualistic and irascible. So I think more of us will swim upstream. One of my mentors, Dr. Molly Niedermeyer, gave a talk at our Doc Talks, which is our naturopathic convention in Hawaii. It's by the beach. It's wonderful. And her talk was called Lost Naturopathic Medical Arts. How to keep these things from dying. So it's sort of like if we circle back to our mini trees concept, we need to be doing this with our elders in our naturopathic community. We need to be archiving and studying and storing what they do before they're gone, because the last of our elders who are pre-Zoom medicine are retiring now. I mean, Dr. Molly's 60-something, she's retiring in the next couple of years. We're going to lose her if we don't archive and record every scrap of what she knows, So there's this whole pressure to preserve, because the more electronic and distanced and sterile our medicine becomes, the more we lose the thing that makes it special.
I think there's a lot to be said on that particular topic, and I'd love to come back around on dedicating a whole episode maybe to just the ancestral medicine. And we have a very special health tip of the week for you guys because
something happened to me, girlfriend.
Something happened in real life. Tell me about it.
Okay. So I decided I was going to be extra healthy, and I was going to make a nice, delicious, great, big, juicy salad. And so I cut up all my vegetables, and I cut up my cabbage, and I throw it in there, and I've got lettuce, and it's all great. And I eat my salad, and it is good. It's really good. And then I'm putting away my vegetables, and I look, and there is something black in my cabbage. The other half of the cabbage that I didn't eat. And I look more closely, and I see the black thing is moving. And I look more closely, and I see that it is a flatworm. Or let's be more accurate, it's half of a flatworm, which means I ate the other half of the flatworm. And for those of you that don't know what a flatworm is, it is a creature that can live in eats plants, but can live in the soil. And it got up in the spiral part of the cabbage. So even though you wash it, it was still there. And it carries a nematode, which is a parasite called Angelus strongylosis, or for normal people, rat lungworm, okay, in Hawaii. And this is an introduced parasite that is incredibly dangerous. And the slugs and flatworms of Hawaii are contaminated with this nematode, and we have high levels of them in our critters compared to Thailand or other places where this is a tropical disease. Although if you eat vegetables grown in the tropics, which are then shipped all over the world, it could also relate to you. Okay, so simple mistake. Didn't see it in the lettuce, didn't see it in the cabbage, ate it. Okay. Very dangerous because it can cross the gut barrier, get into the bloodstream, go to your brain and eat your brain, like literally live in your brain. Not good. Okay. So what do we do about this? So now I have patients with this condition and it is incredibly painful and a little worm crawls through their brain. Okay. So we don't want that. So first off, check your produce carefully. Second off, the main thing that keeps parasites from getting into the system is stomach acid. Okay, so we all need to check and make sure that we are making adequate amounts of stomach acid. So one of the reasons I do physical exam in office is because there are physical checks that I can do to see if someone is likely to be making enough stomach acid or not. There's downstream signs and clues that we have that can help us know if that's happening for you or not. Short story, if you are really stressed and have been for a while, you quite likely are not making enough stomach acid because stress turns off digestive energy. Okay, so also, if the reason that works mainly is because stomach acid triggers the body to make bile. Bile's what the liver makes. Bile digests the little bodies of these little parasites and keeps them from living in you. Okay, so if you think you might have been exposed to a parasite, one thing you can do is take bile salts if you don't have access to medication. Bile salts, a standard process, is my favorite supplement company, and they make something called Cholecol. Cholecol is a bile salt replacement that you can take with any meal or any fatty meal that will assist your body and replace some of the bile you may not be releasing. If your stomach acid's low, you don't release your bile. So you can replace that in that meal and then digest your fats better and digest parasite bodies. Okay, so did that. Short tip, the CDC has said that if you are exposed to a nematode like rat lungworm, you can take parental pamoate, which is a medication that's available over the counter. It's usually sold to treat, what's the itchy butt one? Itchy butt worm. Itchy butt worm. The little kids get pinworm. Thank you. It's sold as a pinworm medication, Reese's pinworm medication, over the counter at any drugstore. So if you think you might have been exposed to a parasite in your salad, you can go within like 12 hours is best to go and take a dose of that pinworm medication. It's banana flavored. It does not kill the nematode, but it paralyzes its little body so that it has a really hard time burrowing through your gut wall and getting into your brain, which is a good thing. We don't want it in our brain. So at least if you can take over-the-counter, easy-to-find parental pamoate, A, it'll get rid of any pinworms you may have hiding around. And remind me to tell you the Scotch tape test. That's really fun. Okay. But B, it can go a long way towards at least buying you time to go in and get other medications for rat lungworm. There is a medication called albendazole that doctors can prescribe that kills this parasite before it can get into your system. But that's a prescription medication, okay? But parental pamoate is available to all of us, okay? Cats and dogs can take it. Like it's also used to treat parasites in pets. So relatively safe. Read the label. Okay. Scotch tape test. We have time for that.
Yeah.
So if your kids are all squirmy poo and you've been to a daycare or you've been to a preschool, your kids could have pinworms. Those are tiny little critters and they live in the gut and they make kids squealy and people think that they're teething maybe, but sometimes they're irritated because they have little gut parasites. So a quick trick is to take clear Scotch tape after kids go to bed at sleep. We're talking young children, right? Yeah. You can put Scotch tape on their little butt and the pinworms crawl out at night. That's why it itches. Their little butts itch. They crawl out at night and lay eggs around the outside of the butthole. They do. It's true. But you can put Scotch tape on there and then pull it off and you can shine it up to the light and see the little parasites there. And then you would need to give them what? Reese's pinworm medication. Now, there are natural ways to help reduce and kill parasites, but we're doing a shortcut tip. So sometimes we need to blend our medicine. See, this is me being moderate, right? There are many, many natural ways to help reduce parasites, but I'm just saying short-term, quick, bile salts, and parental pamoate. There you go.
All right.
Tip of the week.
Dr. Sally approved.
Banana flavor.
And it's banana flavored. So if you think you have a parasite, go over to your local drugstore and get yourself some banana flavored Reese's pinworm medication.
And the natural version is standard process Cholecol or bile salts in general. Bile salts are usually very helpful. But do not buy things on Amazon, please, please, please. Most of that stuff is fake. So get it from a physician's office or at least a health food store. Because there's so much rip-off stuff on, I mean, I've gotten products that were supposed to be good from Amazon and they're the wrong pill shape. They're the wrong pill color. Like there's so many ways people are getting ripped off by supplements on the internet it boggles the mind. And then they go, oh, I tried that natural stuff and it doesn't work. Well, you get straw in a capsule. So it's really frustrating to me because I don't know if my plan is failing the person, if I got the wrong diagnosis, or if they just bought junk crap on the internet and that's not working. So to solve that problem, there is a company called FullScript that is like a clearinghouse, and really high quality supplement companies have to be approved to be sold through FullScript. And every product that's sold there is third party checked to at least make sure what's on the label is in the darn bottle. Okay. So you don't have to wonder if that's why your product's working or not working, right? And most of them are checked for heavy metals and contaminants, which is not true of health food stores or the internet. So what I think I can do is have a link to them and a way that people can get these products through this certified third-party approved vendor if they want them.
Have some links for you down in the show notes. We definitely are going to have links to all of the social media accounts for Dr. Sally if you want some bite-sized content throughout your week, some bite-sized education, tips, all that kind of good stuff. You can follow Sally at Doc Sally ND everywhere on social media. And again, these podcasts are going to be coming out every odd week on Wednesdays. And you can find them on YouTube as well as any other streaming platforms where you like to listen to your podcasts. So that being said, yay!
Thanks for listening.
We just recorded our first podcast together. All right, until next time, aloha.